Hi, everyone, and welcome back to another episode of Dream Daringly. I am so excited because today I'm thrilled to welcome Dr. Maria Reebs, owner and CEO of Modern Vital Aesthetics. Thank you so much, Maria, for being on today.
Thank you so much for having me. I'm so pleased.
Well, let me tell you a little bit about Maria. She is a doctor of nursing practice and family nurse practitioner with a focus on integrative health. She's passionate about helping her clients experience real transformation, and we're big about that here. And not just through aesthetic treatments, but by truly listening to their individual stories and curating personalized care. Her work reflects a deep belief in the power of change, both inside and out. And today we're going to dive into the anticipation of transformation, navigating personal and relational shifts, and how change impacts not only our perception of ourselves, but also how we're seen by others. So thank you again so much for being here with us, Maria. We're so honored to have you.
Thank you. Thank you. I'm excited for this conversation. I love this topic. And yeah, bread and butter for me every day.
Oh, yeah. So Marie and I know each other through our local chamber of commerce, and I do not know why all of a sudden I am so tongue-tied. It's probably because I've been so excited to talk to Maria for so long. And she is one of the people that I just admire so much. She has been working diligently, not only in her business of what she does, but I've watched her go through her studies to become a doctor, nurse practitioner. Is that the way to say it?
Yeah, it's a unique degree. So there's a lot of ways to say it. You could say a doctorally prepared nurse practitioner.
Ooh.
You could say doctor of nursing practice, family nurse practitioner. It's yeah, it's a multifaceted degree that could be taken almost any direction possible in healthcare. And it's really hard to encapsulate in the title. So,
It is. It is. I love all of that. And not only has she been running her business, Modern Vital Aesthetics, she's raising a toddler. She'd been going to school to get her doctor of nursing practitioner. If I said that correctly. You've given me so many wonderful
that's
words. I
great.
mean, she blows my
Great.
mind. And I respect you so very much for doing all the things. And to know Marie, you have to understand that she is very, very concerned not only about how she does things, but intensely on the way it is carried out. You are particular about the ingredients that you use for your patients. So you are always making sure that it is the top of the line and the research that goes into each of these products, correct? Because I went to your grand reopening of your beautiful, beautiful store. Um, a spa, I guess what would you call it? How do you
It's a medical spa
medical spa, thank you.
and clinic too.
And I was just blown away because again, the care and attention that goes into every detail is just truly is meticulous.
Mhm.
And when somebody is doing the type of work that you do, that is something that stands out. So today, again, we're going to be talking about things that our listeners, as well as your audience, are really concerned about and love to talk about. And one of those is transformation, of course, because your clientele come to you looking for a particular type of transformation. Now, given that you've worked with countless clients who are seeking aesthetic transformation. So let me ask you, Maria, what do you find most surprising about how people anticipate change in their lives before they actually experience it?
Yeah, I think the thing that surprises me over and over is just the variety of the human experience and
Mm,
the variety of why people choose to do what they choose to do. both in practice, medical practice, and in my business as a medical aesthetics provider. There's a lot of my clients and patients are going through active change. With the medical aesthetics piece, there's a lot of life changes that prompt self-care type practices. Some people have never done medical aesthetic services. Other people have dabbled in it, but a lot of the people I see, it's a big life event that prompts them to come in and to seek the transformation that they want. Like, I see a lot of people who are going through relationship challenges or change, whether it be a new relationship, exploration of that, or a breakup or divorce is very huge. And people are kind of looking to step into themselves, but also step into new aspects of themselves, which is really exciting and very positive a lot of times, but it does come with some other darker, like undertones, but we'll talk about that. Does that answer your question?
Yeah, no, and I love that you said that. So when you're talking about that active change, that's the literal active changes you're talking about, whether it's going through either on one end of it, entering a relationship, and conversely on the other side, whether you may be going through a breakup or a divorce.
Yeah.
Okay, and so what might then be some of the common mental blocks you see when they know they want to take this to the next level and they come to you on the verge of this change? What might be some of those mental blocks that they might be facing?
Yeah. Well, for aesthetics specifically,
Yes.
there's kind of a common theme that can also be seen in like change theory for organizations and other applications of change theory. And the first thing is people want more information. People want to know what it would take to get to their perceived desired change. The goal that people come in with is oftentimes adjusted, and it can be in flux too. So that's really important for me as the performer of procedures to discuss with people and manage expectations on. And so the biggest barrier is just the knowledge. So people are coming in and they're asking, what is even possible and where can we get me to? Another barrier with that is the uncertainty of the outcome. And that's again where I come in and we talk about the different possibilities. There's a spectrum of results. There's also the possibility of things not looking like what they thought they would look like initially in their head. But once we talk about it, a big one, a good example is like getting your lips done, getting your lips filled. Some people come in, they know they want their lips to look natural, rehydrated, and in a beautiful shape, but they're coming to me to ask these questions of like, how is this even possible? Or will I look botched? Because that's all they see online for the most part. And so education is a big piece of my puzzle where I tell people what is possible and educate them on the product that I can use, and then ultimately give the decision power to them. They're making that decision. Do I want to change? Do I want to have this transformation? Or do I want something else? What do you actually want? A lot of people actually want to feel something. They want to feel good about themselves, or they want to feel like they're in control over their image. And so that's an interesting element too.
Okay, we need to unpack what you just said, because that in and of itself just shows you the caring and dedication that Maria has to her craft and her clients and her patients. because helping someone to understand the process, of course, is part of what you do as a doctor.
Mhm.
But the caring piece of it is giving back someone their agency, handing back the power to them. Because we've all been in positions where that has just not been left on the table. It's kind of like a whatever situation, especially in the medical field. But helping someone in a caring way understand, be very informed, and giving that knowledge and removing the uncertainty and giving that sense of free will, but the more important aspect of the sense of agency remaining with you really is the important factor, because now it's no longer a how do I get over this? It's what, like you said so profoundly, it's like, what do I want? How
Mhm.
does this affect my life? So if I do this, what does my life look like? And I'm not doing this for someone else, I'm doing this for myself.
Mhm.
And I would
Yeah.
imagine more times than not that people end up doing it.
Yeah, it's a really big part of being a healthcare provider is assessing for readiness of anything or and there's something really cool called motivational interviewing, and it was a
Yes.
focus, yeah, in my program at University of Portland, for us as integrative focused providers is to use motivational interviewing um, as part of our approach to almost anything really. And a good example of using motivational interviewing is with smoking cessation. And so when you're assessing the situation of your patient who comes to you and they are an active smoker, well, first of all, as a provider, you need to make sure that you're aware of your own unconscious bias for substance use or, lifestyle, and make sure that you're aware of your opinions and set them aside because this isn't about you. And when you're having an interaction with your patient and knowing the consequences of this lifestyle decision, smoking, you are bringing all that knowledge, but you have to make sure that you're meeting the patient exactly where they're at in the change process. And so when you're doing motivational interviewing, the first thing you do is you ask your patient, where are you at with this lifestyle decision? Like, do you smoke every day? Do you feel like it's affecting your life? Do you feel like you want to stop? And at that point, you can, based on what they're saying, you can see at which point of the decision-making process they're at. If they haven't contemplated change, then you ask for permission and say, can I give you some information about some of the outcomes we see with smoking? If they give you permission, then that opens the floor for you to come in and share what you know. And it's a whole process where then they have to digest what you said. It's not like, okay, you need to stop smoking now. That doesn't work. That's not how change happens.
No.
And so kind of using this model, you can like extrapolate it from like the clinical setting to the medical aesthetics setting where you have someone coming in and you're assessing where are they ready for the transformation that they're going to have, or are they in the very beginnings and they have more questions than decisions that they can make in that day.
It's so interesting because it's very similar in a coaching setting, because someone has to want to create their transformation. And as a coach, we do similar types of, motivational interviewing to understand and meet someone where they're at, because you can't force someone to create change in any type of environment. And it's even like parents, right? we can't want something for our children more than they want it themselves. We can invite the change and show them, model maybe the behavior, but until somebody wants something for themselves, we can show them the pathways, but until someone is ready to accept it, then, so I love everything you're saying, because Maria is a smart doctor here and she does absolutely know what she's talking about. So, and it sounds like you're already talking about how you're guiding your clients through these mindset shifts. So when somebody comes to you and they've gotten to this point where you've now gone through these steps and you see that they're on the precipice of going, yes, I want it. What might be those final steps of allowing for them, once you've given them all the information, does it take us a few more sessions, or maybe is there some smaller aesthetics that they can start with?
Yeah, yeah. If you want to get into like the nitty-gritty of my services, like there's a lot of gateway services.
Well, I'm curious because I'm someone who hasn't yet done any of that, and I've always been really interested. And, obviously this is not the podcast that we talk about these things, but
Yeah.
but given that we are talking about the mindset shifts that enable someone to do, whether it is, doing a gateway service or, stopping smoking or whatever it is, it's like, I think these things all line up with how does one start with something small, because similarly in coaching, like we want to take the smallest possible step that leads us to the next step that allows us to create the momentum that we can have change.
Mhm.
Right. And so if I were looking to do something that you've given me the information, I know this is something that now that I, have my agency, I've taken my power, what would be one of those gateway services that you're talking about? So both of our audiences have a better understanding of what that might be and what that looks like.
Mhm. So if someone, well, first of all, can you hear me okay? There's some sounds out there.
No, totally fine.
Great. Um, so, um, assessing for goals is important because, there's so many ways you could take the little steps. For example, if someone, is coming in because they are concerned with jowls, that they're starting to form jowling, it bothers them, and that's what they come in with. Well, jowls are kind of a later stage manifestation of other things. There's skin laxity, there's volume loss in the cheek that happens.
Mhm.
A lot of it's sun damage can affect to just the way the integrity of the ligaments of the face, and lifestyle factors. And so when someone comes with jowls, we can talk about, what are the steps we can take to get there, and if it's even possible. And so usually what I start with is revolumizing the cheeks, which is not what people expect.
Interesting.
Mm-hmm. And maybe a better example would be is someone who's coming in for because their lips bother them. Maybe they're smaller in size, or they have become smaller with age.
Mm-hmm.
Maybe they're a little dry, dehydrated, and they want a more plump look to their lips, but they are not ready for lip filler. There are a couple other things we could do. I have topical products. I have lip treatments that I can offer them. I can offer a lip flip, and once, and that's a little Botox where you when you inject right here, and then once this orbicularis oris relaxes, when you smile, there's like a few millimeter difference. And so that's kind of the gateway to getting filler. Once people can see that a little bit more volume and hydration looks good on them, that's when they feel comfortable taking that bigger step of getting the lips done with filler.
Okay, I love that. Now that's helpful information because if you don't know, you don't know.
Yeah. Yeah. And in sales psychology too, which, it's a fine line being in healthcare, but also having a business and kind of working through all the gray areas. But in sales psychology, you know that you have to see that your client is actively putting themselves in the situation of being happy, of having this new transformation, of having this luxury item at their hip, their new purse,
Mhm.
or wearing that dress and feeling so amazing. And so and I think that's part of these little steps, is that it's kind of dipping your toe into that transformation where all of a sudden, yeah, I can see myself having plump, juicy looking lips. Okay, I'm ready. Let's go for it. Let's do it.
So what we talk about on this podcast all the time is the visualization aspect of manifesting. So it's closing our eyes, or even if we're doing a walking um, visualization, it's just like putting ourselves in the feeling of what that will be like, linking those two things, like having the aspect of what this gives me and opening ourselves up to the creative possibilities
Mhm.
of this new transformation that I aspire to, and linking ourselves in the present to that future self,
Mhm.
because we have to make it manifest now to have it created and link that vibrational, so we'll attract it to ourselves, if that makes sense. So knowing how I will look, even if it's not that exact same thing, just allows for that to realize itself. So having those bigger, beautiful lips and just being in that vibrational state of, this is something that will be, that I'm in alignment with, or I'm not in alignment with it, for, clarity's sake. And if that's like, you feel really expansive about that, then you can get in that flow of going, this is definitely something I need to move towards. And everything you're saying, even if it's the purse or whatever, it's like, I see myself with this. And what life am I creating now to realize that going forward? What steps am I taking? So everything that you're talking about is, we love.
Yeah. Yeah. And I'm sure as a coach, you have this experience where you sometimes work with people who don't know what is possible. And so you are the guide showing them what is possible. And as a healthcare provider, this is a big job for me too, is what is possible, and does my patient understand what is possible, and how do I get them from point A to what is okay for them at point B. With a lot of people, who have been sick for a very long time, um, they don't have their physical activity up to the point that we want them to have for a healthy, happy, fulfilled life. But for a lot of people, it's like, can I even walk to the mailbox? And that's your first goal for the
Right.
transformation, is, can you take the 90, 100 steps to your mailbox every day this week? Is that going to put you out? How do you feel in your body after that? Can you do that twice the week after that? And then we could talk about, other conditioning and other things. But there's a lot of that in healthcare where you're just kind of moving that target for people, with people, and empowering them by having objective data for them, like, oh, look, you've done this every day, good
Yeah.
job, you can do your next step. And how do you feel about that? And so that's a big part of what we do as healthcare providers. And in aesthetics, um, it's informed consent is really important too, where you make sure that people understand, the longevity of the services, and um, the impact they could have on the rest of their body, their face. With filler, you have to, talk about lymphatics and stuff like that. So, yeah.
Well, that's what I love about you, because you're very well-rounded in the experience that you give your clients, because it is a very holistic approach that you give your clients. And that's what I think appeals to me the most, because it's a linear process, but it's one that you approach in a way that helps them in a fully encompassing. We're not just doing one service, we're helping you with your mind, body, and soul, so you feel empowered and you understand that this is a nuanced approach to your life. So you feel, not only when you look in the mirror, you feel differently, but we want to help you from the inside out, because that can be the true transformation.
Yeah.
Because if you don't feel good, if you're not, I call it here, loving yourself fully, fiercely, and first, then no matter, the bag, it won't make the difference that you truly want to see. And from everything you are saying, that's what I admire about you so much, because that's what you care about. And I hear it in everything that you do and say. And that means so much. So for everybody in the Portland area, trust me, this is the woman that you definitely want to come and see when it comes to anything. And we will link to everything in the show notes about Dr. Maria and how you can get in touch with her.
My
But now,
if I can't do it, I won't do it. And I'll let you know the best person who can. So that's my commitment too.
I love that as well.
I can't be the expert of everything, but my training is like a kitchen sink role. And the role is to, put things where they need to go and point you to the right direction. So
yeah, and see, and that in and of itself is the ethics of it. And this is why I have my preferred partners, because one person can't do it all. And it's having that understanding of that. Now, and this gets me to the next question that I've been thinking about, is because transformation, it doesn't just affect the person going through it, right? It has an effect on the relationships and how we're perceived by others. So can you talk more to us, to speak more to how you've helped people, or what you may have seen in these perceptions of family, friends, and colleagues of perhaps what your clients have gone through?
yeah. So in aesthetics, you can have radical transformation within a couple hours, really, if you use some of the bigger tools like filler, you can definitely come home with a different face, pretty much, with some recovery time. But with that, there is a lot of like after effect, and some people are more prepared for that than others. There's yeah. I think during consultation is arguably the most important touch point for these types of procedures and services, because in the consultation you kind of want to gauge, what's the purpose of the transformation, and what kind of preparation the person has done for it, and socially will it be acceptable for them. Usually it's not a very big deal for people, but for some, dramatic change is a shock and needs to be discussed beforehand. So an example of a big change for people is when they come in with years of prior filler in their face, in their lips a lot. And I have to break it to them that they have massive migration of their filler and it needs to be dissolved before I can, in good conscience, do any other filling for them. And so there's a lot of preparation mentally for dissolving a filler. It's usually a process depending on how major the migration is. You're pretty much within 2 or 3 days shrinking everything. You're
Oh,
flooding the area with a dissolvent, and the body metabolizes the desiccated filler, and you go from having a lot of filler to hardly having any at all. And so that change really shocks people. And for someone who may have like a background in body dysmorphia or have, just some strings of dysmorphia, that can really, really trigger people. And so we talk about that a lot. And the best type of preparation is, again, putting yourself in that position. And during the consultation, we talk about how that would look like. Do you have any social events coming up? You will experience some emotions, like, for sure. Um,
yeah.
the intensity of them depends person to person. Just be ready that you will, and feel free to text me if you need to talk, you know.
Mm,
So there's that type of change that we manage all the time. Yeah.
wow. Okay. Thank you for sharing that, because, again, if you don't know, you don't know about something like that. Um, oh,
Yeah.
um,
Yeah,
so
it's important to know trends too, and to know what's popular out there, but also like the consequences of what's popular. And for example, we see a lot of the Russian lip trend right now with lip filler, and that's where you add both volume and height to the lip in a way that's not sustainable for the anatomy of the lip. A lot of times the technique is not executed really well, especially here in the States. And so what ends up is migration within a matter of a couple months.
can
And
you say more to what is migration for those of us who don't know what that means?
yes, so filler migration is pretty simply when filler goes where it's not supposed to be. In the case of lips, it goes past the anatomical lip border into
Oh,
the muscle or just this sub area here. And it also often goes inside of the mucosa, like that wet part where your lip goes from dry to wet.
right.
It's where it likes to settle and create bumps. And so those need to be dissolved or they start posing an infection risk.
Oh,
Yeah.
what other trends have you started seeing lately that could pose a risk like that?
The Russian lip, for sure. The
Mhm.
extremes of the Russian lip, slamming a ton of filler into a small space too quickly is a good
Yeah.
way to push it, because filler likes to go out through the path of least resistance. And so if there's a high pressure area, it starts to want to get out. Um, Another trend that's a little disturbing is I think we have a lot of how do I say this? I feel like injectors have tools that are quite easy to use and easily accessible to us. And a lot of times those tools are not the best tools to use for the long game. Um, so a big disturbing trend I'm seeing is filler in the lower part of the face, where people are sculpting jaws and um, filling chins. And the look is so disbalanced and so like it's like a caricature of, it's like Lord Farquaad from Shrek, or
Oh,
yeah, or Saw from Jigsaw from Saw. It's that kind of comical look where it's overfilled, and that's just a trend. You know, these before and afters on Instagram are, you know, someone comes in before and you're like, okay, what's the after? Because this before is looks balanced to me, you know, maybe with some minor tweaks, but then all of a sudden there's a big chin. And it's like, oh no. So,
okay. So this, I mean, again, this is not typically the type of thing we talk about here,
yeah.
but because it is, because we're all looking for different types of transformation, right?
Yeah.
And it is about our mindset of ourselves and loving ourselves fully, fiercely, and first. And the neuroscience in if we are not happy with our forward facing presentation of who we are, that it has a big effect. So I think it's very important, since not everybody lives in the Portland, Oregon area.
Mm-hmm.
What would be the best advice you could give people who are seeking out to have aesthetics treatments in finding someone as diligent as you? How could they best do that?
Are you asking how they can find a practitioner that
Yes,
would get them the result they want?
yes. And who they could find that would be, because, we all can, it's difficult to go and, reviews are one thing, but what would your best advice be in seeking out a practitioner that, I guess I apologize that I'm not saying this as succinctly as I would like, but how do you read between the lines in finding someone that has done their due diligence and has an approach similar to yours, where they're, caring and have done their work, and it's not just, they're going to be doing trends like that, et cetera, et cetera.
Mhm. No, that makes sense. It's a good question. I think that the proof is in the pudding when it comes to documented results. Um, Before and afters, looking at someone's before and afters is really important.
Okay.
Now, almost all aesthetic providers show people before and afters because everyone is visual, everyone has their own style. And so you can pretty quickly find someone who would perform a procedure like in your style if you see them trending on their before and afters. So for example, on Instagram, you can start following injectors and kind of look through their page and see what their afters are like versus the befores. That's important. But what I also know is that some of the best and most seasoned injectors out there, they're not very tech savvy. And so consultation coupled with the before and afters, I think would be your best bet.
Okay. And what about their education? What would your best recommendation be with someone seeking out a practitioner?
Um, there are so many, it's such a wide range. There's so many different types of providers too that are excellent at providing these services.
Okay, maybe I should rephrase that.
Oh, no, 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 no. It's okay.
Oh, who shouldn't someone be seeing for this type of work? Because maybe that could make that a little bit easier.
Yes. People who aren't licensed in your state, um, you should not go to people who are unlicensed. I would recommend, if you have the means to, finding a few practitioners and doing consultations and getting a sense of, what their style is like, and asking for their credentials is a completely normal thing to do during
Oh,
consultation. In fact, we lead good injectors know that their expertise is one of the biggest decision-making factors for people. So we like to lead with that during our consultations. And I would start with, I'm Dr. Maria. I'm a doctorally prepared nurse practitioner. This is my experience with injectables. Do you have any questions about my experience and credentialing? And then kind of setting that tone where it's like, oh, okay, this is the expectation. It's up here.
Right.
And can we
Thank
achieve?
you. That is very, very good information, because if someone is not giving you that, that's concerning, because I would want to lead with that. That's why I lead with, I'm an ICF certified coach. I've done my work. I've gone through the schooling. I get continuing certified education through the ICF, and that might not mean anything to someone, but it just shows my continued diligence to get the education. And for someone who's getting the type of work that you do, it shows your level of expertise. And that's something that, for me personally, I definitely would want to know.
Mm-hmm.
And if you're not saying that to me, I would be, well, I would be shouting it from the rooftops. You've put in so much effort and work that that's definitely a lead.
Mm-hmm. And it's
So thank you.
that's also something, that comes with years of practice and or with nourishment from coaches and seasoned practitioners. I know that the Allergan Institute is a highly esteemed um, education center for medical providers and medical aesthetics. And that's something that stood out to me, is that all of their educators lead with their credentialing and their experience. And that makes a huge difference when building trust with your clients.
Right.
Yeah.
Well, no, thank you so much for educating us on how to best approach, our care in that regard. Any last words of wisdom that you can share with our audiences on transformation mindset? Was anything that you'd like to share with us today?
Yes. I would love to encourage people to fall in love with themselves again and rediscover themselves in new ways. Um, as part of the transformation process, we discover these new parts, and it's like a muscle that you can exercise and develop over time. I feel like sometimes life takes us in directions where we kind of lose pieces of ourselves, pieces of our identity that used to bring us joy. And I just love seeing people in the rediscovery process of what brings them joy and developing that. So that's my biggest wish for all you listeners, is to rediscover what brings you joy and to love yourself.
Ah, so beautifully put. Thank you, Dr. Maria. I knew I would enjoy this conversation so much, because you're right. It's our birthright. It's good to feel good. And just having that vibrational match all the time is, I mean, it's not like we can just go around picking daisies all the time, but wouldn't that be nice? But it's good to be in alignment with that feeling of joy and learning how to embrace ourselves
Yeah.
in such a way is absolutely the first best step, because we talk about this here all the time. The relationship we have with ourselves is the longest one we're going to have.
Mhm.
And so we need to make the most of it.
Yeah.
So thank you again for being here with us. And as I said before, we are going to link everything about Maria in our show notes, so you can find her website and everything that she does. And we will, anything else that we might want to know in particular that you have coming up, any specials, anything that you might want to share with our audiences?
Yes. So I'm
Awesome.
starting my practice at Portland Clinic of Natural Health. I'll be seeing people from all walks of life, from pre-birth until all the way to end of life as a family nurse practitioner. We can link that application in the show notes as well. Apply to
Awesome.
see me. Yes, the appointment times are long and hefty enough for us to get to know each other and for me to get a sense of, holistically about you, learn about you and how we can support your health. So those are hour-long appointments, Portland Clinic of Natural Health.
Wow. I did not know that. So thank you for sharing that. Oh, that is so exciting.
Yeah.
This is one busy lady, let me tell you. All right.
Thank you
Well,
for having me. It was such a pleasure.
oh, it was a pleasure for us as well. And hey guys, if you were feeling inspired by today's episode and you do want to help the Dream Daringly family grow, thank you for leaving us a 5-star rating and review, because it just takes a minute and lets others know that this show is a valuable resource for manifesting their dreams. Plus, positive reviews help the podcast reach more amazing listeners just like you. And let me take this moment to say thank you, friend, for being a part of the Dream Daringly fam and community, because without you, none of this would have been possible, nor would it matter. Because I do this for you and I to grow, dream, and live what others might deem unthinkable lives. Remember, Dream Daringly fam, you have the power to create the life you desire. And until we meet again next week, always be dreaming, taking that first step, creating new neural pathways, and taking inspired action so you'll manifest your limitless dreams into existence. And from me and Maria, bye for now.